Audio Jungle. Audio Jungle. Fever, chills, nausea, headache, muscle aches, joint aches, diarrhea, vomiting.
Flu-like symptoms, Bell's palsy,
head pain, and disorientation, confusion.
Common symptoms of Lyme disease include an expanded circular red rash resembling a bullseye, fever, joint and muscular pains, headache, chills, fatigue, and swollen lymph nodes. However, almost all parts of the body are impacted as the disease progresses. Because Lyme disease has many symptoms that overlap with other diseases, it can often be misdiagnosed or untreated. Dr. John Alcott talks about two phases of Lyme disease. Most people are aware of the first phase of Lyme disease.
Or even a month or so, and then if it's not recognized or not treated, it goes away on its own. But the problem with Lyme disease is if that early phase isn't recognized and treated, there's a second phase, a late phase that happens months or even years later, and that late phase looks like a totally different disease.
The deer tick has a 2-year life cycle in which it requires 3 blood meals. It is infected by its first blood meal and can pass on the infection to a human. A vector-borne disease is a disease transmitted by a living carrier that transports an infectious agent from an infected individual to a susceptible individual. Lyme disease is the most common vector-borne disease in the United States. The genome of the bacteria is the most complex of all known bacteria. According to the EPA, the incidence of Lyme disease has doubled in the United States since 1991. Specifically in Maryland, the CDC has recorded an incidence rate of 13.5 confirmed cases per 100,000 people. This is a map of confirmed Lyme disease cases across the United States. In 1990, the amount of confirmed Lyme disease cases in Maryland was 238. That number has jumped to 1,235 confirmed cases of Lyme disease. This is a 418% increase. Increases in Lyme disease have been seen in Maryland due to the rise of urbanization and urban sprawl. This increases the spread of infectious disease agents. People and wildlife live closer together, so we are more frequently in contact with wildlife. Urban sprawl has encroached on deer populations, which are a top host for the ticks and lead to an increased chance in transmission of Lyme disease to humans. In addition, due to growing populations, agriculture has increased. Irrigation systems on agricultural land provide good breeding sites for ticks. These potential breeding sites are what put farm workers at a greater risk for contracting Lyme disease. 50% of people never develop a rash with Lyme disease, and 64% never even remember being bitten by a tick. The at-risk population include pregnant women and children who need to exercise extreme caution while outside. Lyme disease can be successfully treated with antibiotics, especially if treated early. 10 to 20% of patients have persistent or recurring symptoms following antibiotic treatment and are considered to have post-treatment Lyme disease syndrome. Prevention includes wearing long pants and long sleeves when in heavily wooded areas, wearing light-colored clothing so that the tick can be easily seen, applying bug repellent for midges and ticks, and checking for ticks after being outside. Even though Lyme disease can cause long-term health implications, proper prevention of tick bites, early identification, and treatment can increase your odds of a full recovery.
I'd like to check you for ticks.